One thing we often talk about sometimes in between surgeries is working out and staying in shape. It's an important part of both of our lives.
It is.
How have you managed that, or what are some of the physical activities you love doing, and how you integrated that into your ophthalmic education and
Yeah.
training?
So when I was a, you know how they say freshman 15?
Yeah.
Well, I did freshman 45s. So I gained a good amount of weight in college, and I lost it all in third and fourth year of college. When one of my friends introduced me to P90X. So I started doing P90X to get back in shape. And then, but I haven't been doing it for like the past 3 years or 6 years or anything like that. And then just making sure that you work out at least 3 or 4 times a week. And the biggest change in the past 3 years was I started doing intermittent fasting. That has been probably the biggest change in terms of working out or fitness in general. Um, so I do the 16 and 8. So I eat from 12 to 8, and then I fast from 8 to 12. And I drink black coffee in the morning, which makes it really hard for surgical days because you can't have a ton of coffee. and but I think the intermittent fasting was definitely a big game changer in terms of helping me maintain weight when I couldn't necessarily work out as much as I wanted to in some weeks more than others.
You and I are kind of on the same page on that. I kind of stumbled into intermittent fasting accidentally during third year of medical school. I think when I
Hmm.
was on the general surgery rotation, because there was mornings I was getting up at 3:30 or 4 to go to the hospital to do pre rounding,
Right.
and I just didn't have time.
Yeah.
And and then after rounds we would go straight to the OR. And so a lot of times I mean, there were some days I wasn't eating until like dinner. Dinner was my first
Yeah.
meal. And I think I just, especially after intern year, just adapted to that a little bit. So I know people say breakfast is the most important part of the day, but usually I skip it. And honestly, I feel like I have more clarity. I feel like
I
I'm
do too.
firing on more cylinders. I think that's just maybe carbs. Like carbs sometimes slow me down
Yeah.
a little bit. Or if maybe I didn't get as much sleep as I wanted to, I feel like not. I will kind of intentionally make sure I delay when I'm having my first amount of intake.
Hmm.
But yeah, intermittent fasting I feel like has been a huge game changer. What specifically do you do when you work out? Is it just more cardio focused, or are you focusing more on weight training?
So I try to run at least twice a week, and then the other 2 times weight training. Um, most of the time, I do 1 or 2 of the routine P90X routines. And then I'm subscribed to Beachbody on Demand, so I choose kind of whatever weightlifting video looks appealing that day, and then just try and just get something done, even if it's 25 minutes, 20 minutes, 30 minutes. Just get the blood pumping and just making sure that it's part of your weekly routine. It's easy to let go, and you got to take care of yourself.
Something is always better than nothing, and I think that is so true. Even days where I'm post call or super tired, or I just know, I always try to be mentally on top of my game when I'm heading into exercise. But there's some days when I just know I don't. My body's tired or my mind is tired, and I just know that doing something is better than nothing most of the time. It's just accumulating those over a period of time that just
Right.
improves health in the long term. It's so crazy to hear you talk about P90X because I haven't heard someone bring that up since I was back in undergrad. And I had a couple of really good friends who were super into that, and I did it with them for a little bit. And that's a heck of a workout. I
Yeah,
mean,
it is.
it's high intensity, and I don't know, a fairly short amount of time. And I think people sometimes overestimate how much time they need to
Hmm.
get the blood pumping, to get the heart rate up, to do something physical. It doesn't have to be. I mean, even when I do weight training, I don't go train for 3 hours in the gym. It's usually 45 minutes to an hour, maybe.
Hmm.
If I, add a little bit of cardiovascular work on at the end. And so I've tried to be very, very cognizant of making sure I don't let that slip in residency. But I tend to work out in the evenings for whatever reason. That's just
Hmm.
when I prefer it. And as I've gotten older, I think I used to have no problem working out at 8 or 9 p.m. and then falling asleep.
Hmm.
And now it's like when I exercise now, I'm up for a lot longer.
That's why I work out in the morning, because otherwise I have trouble falling asleep if I work out late in the day.
Yeah, so I've had to kind of shift everything a little bit earlier, and then try and make sure. I think sleep is the harder thing now in residency,
Right.
is making sure you get plenty of sleep. You used to play tennis. Are you still doing that?
Yeah. Well, I haven't played in a while, but yes, I still
Okay.
do.
And you founded a couple golf tournaments. How does that
Well,
happen?
so it was just sort of an idea that came up among friends when we were in New York. Um, And we're like, oh, it would be nice to, just have something to do every year and just get some friends together and make it an annual thing where like we pick a city that has very nice golf courses and we just fly there, play for a weekend and then come back.
So it's a thing amongst friends.
Mm-hmm.
That's cool.
Yeah.
That's cool. And you've done that every year?
Yeah, well, since the twins were born, I haven't been able to go, and just sort of life happens. But the tournaments kept going on, so I think last year they had over 40 participants.
Nice.
So yeah, not huge, but not small, not a small group. I mean, it's hard to coordinate 40 people traveling to the same city, the hotels, the tee times. I mean, it's essentially taking up the whole golf course. Yeah.